So the research really shows that you can get equal benefits from a range of different exercises, from strengthening exercises to aerobic exercise. And so it's really important that the person chooses something that they enjoy, that they're going to stick at. And that can be done in conjunction with the therapist to decide what's going to be best for you. The exercise that is recommended for people with osteoarthritis includes a combination of strengthening exercises to strengthen up the muscles around the joint, aerobic exercise to improve fitness such as walking or cycling or water exercise, and it also includes range of motion exercises with those other two forms.
People with osteoarthritis should definitely find some time to do some strength training. 2 to 3 sessions a week is ideal, obviously under the guidance of a physiotherapist or qualified exercise professional. We also encourage cardiovascular exercise or aerobic exercise, which slightly elevates your heart rate, makes you puff a little, but to the point where you can still have a conversation, especially when you're first starting out.
The research shows that water exercise can be very beneficial for pain and function, and it's particularly good for people who perhaps have got more severe disease or they're overweight and they want to start a program in the water, because the buoyancy of the water is very good because it reduces load on the joints. The warmth of the water can really help reduce pain and muscle spasm. So oftentimes a water-based exercise program can be a really good way to start before you progress to land-based exercise.
Warm water exercise is a fabulous way to get the joints mobile and take the impact off your joints. It's a lovely way to feel social connectedness in an aquatic environment. So if you do have access to a pool, what a wonderful way to get started. In addition to strength training, cardiovascular and warm water exercise, flexibility and the ability to move the joint through an appropriate range of movement is beneficial. So stretching, yoga type, Tai Chi activities, balance to keep your joint stable are going to be also beneficial exercises for you.
There has been some research about Tai Chi, which is very popular for people, and it shows that there can be some benefits in terms of pain and improving physical function. And obviously the group atmosphere can really be important as well.
With osteoarthritis, we like to encourage exercise wherever possible, but there are a few things to keep in mind that may impact further and cause additional pain in your condition. So anything high impact, like a big jump or landing with really heavy weights in your hands, would not be advisable, especially in that early stage of exercise and getting started. Things like running even would be too much probably at the start of a new program. So just making sure that your exercise is appropriate, and we can still do vigorous exercise because you can cycle really fast on a bike, but it's not too much load and impact on your joints. You can still get your puff up in the pool as you're moving your aquatic dumbbells through the water, but you're not getting that impact on your joints. So we do encourage vigorous exercise as we progressively overload the body as time goes on, but we certainly would hate to see any jumping or any sort of high impact movements that were going to put a lot of pressure on the joints. People with osteoarthritis can have an additional condition of obesity, and as we're trying to drop our body weight, it's certainly advisable not to put too much pressure on those joints.